Hi, I'm Dr. Lakshmi. I'm the consultant plastic and cosmetic surgeon at Pace Hospitals, High-Tech City, Hyderabad. Today, I would like to discuss a topic called abdominoplasty or tummy tuck. This is a surgical procedure in which excess skin and fat of the abdomen is removed. Mostly, the skin from the lower abdomen and mid-abdomen is removed, and the fat from the lateral abdomen or flanks are removed by liposuction. This procedure helps in contouring the waistline and removal of the excess saggy skin and resistant fat. There are various procedures. Mini tummy tuck, in which there is a scar only like very small in the lower abdomen, that is under the undergarment fold. Line will be like a mini cesarean section scar, like that. So in this procedure, the excess skin and fat of the lower abdomen is removed. Sometimes umbilicus might be repositioned, or it can be kept the same, and the fat is removed by liposuction procedure. The other procedure is complete tummy tuck, in which the scar extends from one hip to another hip, and this scar is also in hidden areas under the undergarment line, and the lower abdominal excess skin and fat along with some part of mid-abdomen skin and fat are removed, and the lateral abdomen and the flank areas fat is removed by liposuction. The muscle and fascia are also tightened. In every tummy tuck procedure, the muscle and the loose fascia are plicated so that the muscle and the fascia are in tension and there won't be any protruding of the abdomen muscle or fascia due to the weakness in them. The other technique is like extended tummy tuck, in which the scars are extended beyond the hips and onto the lateral aspects. In this procedure, sometimes the upper thigh is also tightened so that upper thigh lift also happens. Apart from the extended tummy tuck, there is a circumferential also, which is all around 360 degrees. In this, even the buttocks areas are lifted up. So, the extended procedures will also involve the thighs and buttock lifts. And apart from this, there is a floating tummy tuck, in which the umbilicus is just detached and whatever the excess skin is removed, and the umbilicus is repositioned into a new area which is aesthetically pleasing. So these are the various types of tummy tuck procedures or abdominoplasty procedures which we perform. The procedure is usually performed under general anesthesia. After proper anesthesia clearance, the general anesthesia is ideal for this procedure. First, the liposuction is done in the lateral areas and also in the central areas to improve the contour or to bring the best waistline after the tummy tuck procedure. So, after the liposuction, there will be an incision placed in the lower areas from one hip to another hip, and the excess skin and fat of the lower abdomen are elevated from the underlying muscle and fat. After this is elevated, the muscle and fascia are tightened or sutured so that any weakness in the muscle and fascia will be repaired through this plication technique. And for suppose if the patient has umbilical hernia, even that hernia can be repaired through this procedure. After the tightening of muscle and fascia, the excess skin and fat in the lower aspect are removed along with some stretch marks in the lower abdomen, and the layers are closed with either absorbable or non-absorbable sutures. Sometimes the drains may be necessary if there is some bleeding or if a patient has more bleeding tendency to prevent any post-operative hematoma or seroma. And after the procedure, on table itself the compression garment is placed so that post-operative swelling and edema can be reduced. Usually the procedure varies from patient to patient and their body condition. Usually it ranges from 2 to 5 hours depending upon whether liposuction is needed or whether mini tummy tuck is done or full tummy tuck is done. So it usually depends upon the patient. And after the abdominoplasty procedure, the recovery usually for daily activities and all, within 1-2 days patient can get back to their daily activities. After 2 weeks they will be good to go and they can start their cardio or minimal walking exercises after 2 to 3 weeks, and the full activity or heavy strenuous exercises can be resumed after 6 weeks to 8 weeks. Patient who is having healthy lifestyle, who is maintaining their ideal body weight and who has fat only in the lower abdomen or mid abdomen, which is resistant or which can't be removed with exercise or which can't go away with exercise, are ideal candidates. Apart from this, some people after pregnancy or after massive weight loss or after bariatric surgery, they will have loose skin or fat, which we can remove through tummy tuck or abdominoplasty procedure. And some people after pregnancy, they can have umbilical hernia or divarication of recti or loose muscle or loss of muscle tone in that area. These patients also will benefit with the abdominoplasty procedure. And the patients should always have a realistic expectations of the surgery, and they should not have any habits of smoking or drug intake which will impact the outcomes of the abdominoplasty procedure. There are relative contraindications and absolute contraindications. So the relative contraindications are like comorbidities like diabetes, hypertension, overweight and any cardiac problems which can be managed. And the absolute contraindications are bleeding diastasis, who have bleeding problems and who have risk of DVT and who are morbidly obese. These patients are not a good candidate for liposuction procedure, or we can say they are absolute contraindications for this procedure. So usually immediately after surgery, there can be risks of some bleeding or hematoma formation or seroma formation after surgery. These can be managed conservatively most of the times. Apart from this, the infection is other factor which is a complication that is very rare nowadays, and the problem of vascularity, that is skin necrosis, can happen where the sutures are placed. So this is also rare though, but it can happen for few people who have comorbidities and like diabetes and hypertension and who has low hemoglobin and all. These are the problems which one can face after a liposuction procedure, but most of them are preventable. Patient should always take a healthy diet before the procedure. Of course, that is recommended, and we also do a detailed workup for their hemoglobin levels, for their any micronutrient or vitamin deficiencies, so that these micronutrients and vitamins which also affect wound healing can also be corrected before surgery. Apart from this, patient should maintain at least 6 months of stable weight, or they should not be losing more during the 6 months, or they should not be gaining more for at least 6 months before the surgery. And we always recommend patients to stop smoking at least 2 to 6 weeks prior to surgery, so that the problems of skin necrosis or flap necrosis can be avoided. Of course, they are permanent. the main thing is that patient should maintain their healthy lifestyle post surgery, and also they have to maintain their stable weight. And if the patient is planning pregnancy after getting surgery, that will have effect on the outcomes of the surgery. So if a patient is planning for pregnancy, we always recommend them to complete the family before the abdominoplasty procedure, so that they can have the best outcomes after the surgery. So the stretch marks of the lower abdomen will be gone because the excess skin of the lower abdomen and mid abdomen are removed. But the stretch marks of the upper abdomen will be pulled down. So there will be minimal visualization of the upper abdomen stretch marks, and the lower abdomen stretch marks will be gone after the procedure. Of course, it is recommended to get liposuction procedure along with abdominoplasty, because there will be a contouring 360 degrees, like in the back, in the flank area, in the lateral abdomen, and better redraping of the skin is possible after liposuction procedure, and some stubborn areas of fats which we can't remove surgically can be removed via liposuction procedure. And this liposuction procedure will also improve the waist contour and the overall shape and the outcomes after abdominoplasty procedure. So it is definitely recommended for liposuction along with abdominoplasty procedure. A board certified plastic surgeon who is trained in cosmetic or aesthetic surgery and who has experience in abdominoplasty or tummy tuck procedures is the one you should consult for. And also you should look for the equipment which they are using and the hospital setup which they are operating upon, because it is always preferable to have a full-fledged setup rather than a clinic setup in which you will be operated upon, because there will be always backup and there won't be any risks associated with the procedure, because some untoward circumstances can happen, like some allergic reactions or something which can happen, and post-operative care can be taken care in ICU with ventilator support.